Hello, this is Dr Gareth for Jacaranda Maternity. Apologies for the late start. I had a patient I had to see, so I've seen her and now we have some time to talk about our pregnancy questions. So if this is your first time attending this TikTok, basically once a month I usually sit here or somewhere else and people send in questions about their pregnancy and I just try to answer those questions for people at home. And so we can start straight away. We have a few questions already, and you're welcome, if you have any other questions, to send some questions in, and we will try and answer as many questions as we can before 3 o'clock. So let's go there. So basically the first question is, can you please explain Braxton Hicks? I experienced pain in my belly the whole day, but later it went away. So Braxton Hicks are what we call practice contractions. So later in the pregnancy, right towards the end, maybe 35, 36 weeks, what happens is your body is trying to get ready to have the baby. And so your womb does these things called Braxton Hicks, which are like practice contractions. Now a true Braxton Hicks contraction, it's hard to say. Oh, I should also apologize as well. There's some building work upstairs, so you might hear some like funny hammering and things like that. The womb does these practice contractions, and what happens with a true Braxton Hicks contraction is that the womb goes tight and hard, and you feel it go hard, but it shouldn't be very, very painful. It should just be like, oh, that feels funny, but not painful. If you're having really painful contractions, so if your tummy goes hard and it's really painful, it takes your breath away, like, whoa, that's hard, then it might be that could be an actual contraction. So if your pain is coming regularly, if you're at home and let's say you're 36 weeks and you're feeling that your tummy is really hurting, then you might want to come and get assessed and just check that you're not in slightly early labor. But generally speaking, if the tummy just goes tight and hard, but it's not really painful, it's not strong and really intense, then it's probably just a Braxton Hicks contraction, and that's just your body getting ready to have the baby, these little practice contractions. There's nothing dangerous about them. The next thing is, can non-treatment of gestational diabetes cause heart problems with the baby during pregnancy? So the answer to that question is no. So gestational diabetes is a condition that occurs usually later in pregnancy. So if you think when you first get pregnant, your baby is, say, 6 weeks, 7 weeks, 8 weeks, very, very early. At that time, gestational diabetes doesn't occur. And when you have the baby at that gestation, that's when the heart of the baby is being created, is where it's being formed. And then after 12 weeks, the baby is actually complete. You know, its heart is there, legs there, everything is there. And then after that time, what's happening is just the baby is growing. So the formation of the baby's heart occurs before gestational diabetes usually becomes a problem. However, some people are diagnosed as having diabetes in pregnancy, but actually they were diabetic before, but we didn't know it because they only found out in pregnancy when we did the test that they have diabetes. So sometimes there are women who actually have had diabetes for many years, and we only find out at 24 weeks. So if a woman has actual diabetes before she's pregnant, some of those women, their pre-existing diabetes can cause heart problems for the baby. So if you're a woman who's got gestational diabetes and the baby has a heart problem, it's important that you talk to your doctor about making sure that after the baby is born that you get a diabetes test. Because sometimes people just finish their pregnancy, have their baby and say, good, I'm good, I don't have diabetes anymore, I'm fine. But some people actually still do have diabetes after the pregnancy. So it's really important that you get your diabetes checked 6 weeks after your baby's born. So your baby's born, 6 weeks later, all of the pregnancy effects have gone away, all the hormone changes, and 6 weeks after, you're back to where you were before you were pregnant. So you should do the diabetes test then to make sure you don't have diabetes. Are stretch marks preventable during pregnancy, or does it depend on one's body? So yes, I'm afraid it depends on one's body. So we all have different skin tension. So some people have kind of stretchy skin, some people have skin that's a bit tighter. So for some women, when they're pregnant, when their tummy is stretching, they get stretch marks. They're not dangerous, they're itchy, but they're not so dangerous. In terms of preventing stretch marks, people say using moisturizers can help. I don't think there's any strong studies that say they're brilliant, but if you go to a Dukaladawa or a pharmacy and you buy coconut butter, formula, cream, that sort of thing, people say those things help with their stretch marks. Your stretch marks will fade after you've had your baby, but there is no way to prevent them. If your skin is the kind of skin that forms stretch marks easily, you will get stretch marks. And most women who are pregnant get stretch marks, but they will go and fade afterwards. 5 months, and I feel my kicks in the pubic area. Is this normal? Yes, I mean, basically your child is being very naughty and is upside down right now. So if your baby's head is high, and that's quite normal at 20 weeks, at 5 months pregnant. So maybe the baby is kicking around near the cervix. It's okay. It's not dangerous. But yes, it really depends. Where you feel the kicks depends on your baby's position. So if your baby is currently in the breech position and is kicking you, then you might feel those pains very lower down. You can have a word with your child when they're born and say, why did you do that? But right now we can't do much about it. Just try keep moving around and see if the baby will change position. Why do I have a sharp pain on my left upper side? Even sleeping is uncomfortable, so I sleep on my right. So there's a bit of a myth about sleeping, yeah. We don't like it so much when people sleep flat on their back, particularly if they're very pregnant. So if someone is 8 months pregnant sleeping flat on the back, what happens is that the weight of the baby presses on things inside the tummy, and sometimes that can reduce blood flow in your legs and sometimes cause problems with your circulation. So people usually find that they're more comfortable sleeping on their left or their right. And so, you know, if you wake up in the morning one day and you find yourself flat on your back, obviously you can't decide how you wake up, like you might move around in the night. Don't panic. If you've woke up flat on your back, don't be like, oh gosh, something's going to be wrong with the baby. It's not true, but it's just general advice that you should sleep on your left or your right. And then some people say that the left side is definitely the best. It's fine, the left side is a good side, but the right side is also good. So don't panic if you think like, oh, I can't sleep on my left and I can only sleep on my right and that's not good. It's not true. You can sleep on your left or your right, it's fine. As for why you have the pain, usually if people are complaining pain up underneath their ribs, up on the side of their abdomen, it's usually because of your chest widening. So when you're pregnant, you obviously notice that you get the belly, and also you might notice that your breasts get a bit bigger, but your body changes in so many ways when you're pregnant. And one of the ways that your body changes is that your chest gets wider, because you need oxygen and so does the baby. So you need to be able to increase how much oxygen you get in your body. How do you achieve that? Is that the hormones that your placenta is making causes your chest to widen. So if you take a measuring tape and you wrap it around a woman's chest the day she gets pregnant, and then you do it right at the end of the pregnancy, you'll find that her chest is much wider after the end of the pregnancy. And so that stretching of your chest wall can sometimes cause pain. As my common slogan in pregnancy is that paracetamol is your friend. Yeah, so paracetamol, just Panadol or paracetamol, not containing anything else. So things like Sonamoja, Maramoja, they contain lots of different stuff, whereas actually paracetamol is just paracetamol, and that is safe in pregnancy. So if you're uncomfortable at night or you're having issues with back pain or anything like that in pregnancy, then you can take Panadol. Whenever I tell people this in clinic, they're like, oh, really? Like, are you allowed? Yes, you're allowed. It's okay. But most of the reasons why you're getting that pain on the left side is because of your chest widening. However, if the pain is really serious, and is really hurting you, then you definitely want to get assessed by a doctor, because we might need to do a scan to check there's nothing going wrong with your stomach or your pancreas or your spleen or something like that. But most of the time it's just because your chest wall is expanding. And then let's talk about sepsis in pregnancy. How long have I got? So sepsis. Okay, what is sepsis? Sepsis is basically bad infection. It is your body's reaction to a bad infection, and it's a very serious issue in pregnancy. The main reason it's so serious in pregnancy is because of what's called immunomodulation. So, when you are pregnant, you have the baby inside, and the baby is half of you and half of the biological father. And what that means is your immune system is what you do to fight infection. So inside your blood, you have white cells. They float around and they are there to fight infection. But what happens is when you have someone growing inside you who is not completely genetically the same as you, is your baby expresses these proteins that are the father's proteins that are not yours. So your immune system, your white cells, look at this thing and say, this looks a bit like me, but it also looks like something else. Maybe it's a bacteria, maybe it's on this. So what happens is when you're pregnant, your immune system changes to prevent the body rejecting the pregnancy because the baby is half of somebody else. Your immune system gets weaker in pregnancy. So if you've ever had a cold when you're not pregnant, it might last 2 or 3 days. But you might notice that if you're pregnant or you've just had a baby and you have a cold, that it's lasting like 5 days, 6 days, 7 days, maybe even longer than a week. And you're like, why do I feel so rubbish? It's because your immune system is weak when you're pregnant. Sepsis is a situation where someone gets a serious infection, which is usually a bacterial infection. And those people, their immune system isn't ready to fight it. And so they can become incredibly sick. It can affect you before the baby's born. It can affect you after the baby's born. And in the worst cases, it can affect you while you're in labor. So let's say you were in labor and you had a bad chest infection or a bad urine infection, then you will get very unwell because your body is already spending a lot of time being in labor, and at the same time your immune system is weak, and then you've got this bacteria in your blood. You can become very sick. So when we look at women across the world in terms of serious pregnancy complications, the 3 most serious pregnancy complications we see are very bad blood pressure problems, bleeding after birth, and sepsis. Sometimes pregnant women get really bad infections. So the aim of the game for you is just, if you feel like you're having a fever ever and you're pregnant, you feel unwell, make sure you go to see your doctor if you think you have a fever, because we just want to make sure that it's just a mild fever. We can give you some antibiotics, paracetamol, fine. We don't want people to sit at home with an infection and then eventually come to the hospital when they're super, super sick, because people can die if they have really bad infections that they ignore. So that's sepsis. I'm 8 months pregnant and my right leg hurts. What should I do? These are great questions today. Okay, when you're pregnant, it is usual to have aches and pains sometimes, and they're not consistent and they're not usually sticking in one place. So if you have pain in your right leg, it's probably just muscular, and that's fine. But the issue is that if your pain is bad in your right leg, you need to come to a hospital and you need to have an ultrasound scan of your leg. So obviously you've had a few ultrasound scans of your baby in the pregnancy, but we can also do an ultrasound scan of your leg. It is, sometimes the water causes you to itch. There is an amazingly rare condition. It's super, 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 super rare, called aquagenic pruritus. Yeah, it's a very, very rare thing. I've only seen it once in the last 20 years. But people that have that condition, they itch all over their body when they have a shower. So probably you do not have this very rare medical condition. It is probably just related to the skin stretching in pregnancy and releasing some histamine. So then you have a shower and your body gets hot, the histamine releases more, you itch a bit more. But if you're worried, then you should have what's called a hemoglobin level. Check your hemoglobin level. Usually in pregnancy, your hemoglobin level is somewhere between like 11 and 14 is normal. So if you had your blood test and it said your hemoglobin level was 19, then you might want to come and see me because I'm interested in unusual things in pregnancy. So you come and find me if your hemoglobin level was 19 and we can have a talk about PCV and aquagenic pruritus, but probably it's just itching because your skin is stretching. What happens if I'm given the tetanus injection only once and now I'm pregnant again with 2 kids? So you want to probably restart your tetanus injections and do it again. Again, we just talked about sepsis. We said that pregnant women have really weak immune systems. Tetanus is a kind of infection that is super, super aggressive in pregnant women. So there are certain infections that really don't suit pregnancy. So one of them is like influenza. So having influenza A or influenza B is really serious in pregnancy. And another one is tetanus. So tetanus is caused by a bacteria and it's super aggressive in pregnancy. So what we say is that pregnant women who live in certain parts of the world, we don't do this all over the world, but definitely here in Kenya, if you get pregnant and you haven't completed your tetanus course, you should do the tetanus course. The tetanus course is safe to have your injections in pregnancy, and it prevents you from getting this infection, because if you do get this infection and you're pregnant, you are in very serious trouble. So we might as well vaccinate you and prevent you from getting it. So if you missed all of your doses last time, come back and start the course again. Okay, please educate on spotting at around 16 weeks. So in pregnancy, in the ideal world, you should not have any bleeding. That's ideal. But many women, I would say something like 1 in 5, 1 in 6 women who is pregnant at some point experience some kind of bleeding in pregnancy. Spotting is usually the mildest form. It's not so dangerous. But basically, if you're having any bleeding at all, mosquito, if you're having, if you're having any spotting, it's a good idea to come and get checked out. We just make sure everything is fine. Now, usually it's something really minor. So we want to first of all check your placenta is okay. So make sure your placenta is not low. And usually what we will do if you're spotting is have a quick check inside. So we do what's called a speculum examination, where a doctor and a nurse are present, and then we basically just put a little plastic thing inside the vagina and just open so we can look at your cervix. Most of the time we find nothing, and we just say don't worry about it. Sometimes we find what's called ectropion, which is like a raw area on the cervix. Again, nothing to worry about. But sometimes it can be a sign of something more serious. So it could be that you're having bleeding on the placenta. It could be that the cervix is opening a bit. It could be that, and this is really important to check, that make sure you have a normal smear test. So every time, I'm going to say this is a big public health message to everyone listening, yeah? Tell your friends, tell your mothers, tell your sisters. I would say 9 times out of 10 when I'm in clinic, I turn to a woman and say something like, hey, when was the last time you had a pap smear? And most women look at me like, what's that? And I'm like, a pap smear is a very important part of women's health, yeah? This is not about hospitals making money or any of these sort of things. Not pregnant women, any woman who is 20 years old or older, up until 80 years old, any woman can get cancer of the cervix. Cancer of the cervix is a pretty, of all the kinds, and then we send those samples to a lab to make sure that there's no early cancer cells. Because with cervical cancer, it's really, really hard to catch it until it becomes a bit too late. So the only way we can catch cervical cancer is that every year, every 3 or 4 years, people come and they just get checked and just make sure that they don't have it. It's not expensive. It just come, check yourself, and it's just part of loving yourself, I guess. It's just part of doing your women's health check, making sure you're fine, this sort of thing. So I really recommend women get pap smears, because sometimes, very rarely, a woman comes to me spotting in pregnancy. I look inside and I see that actually her cervix doesn't look normal. Her cervix might actually have something like early cancer or something. So it's very important that if you're having spotting, that you get checked out. Most of the time it's nothing to worry about. But bleeding in pregnancy automatically means go and see your doctor, because we need to know your placenta's okay, your cervix is not opening, and your cervix looks normal. But separate to that discussion, please, if you're not pregnant and you're listening to this right now, or you have not pregnant friends, if they've never had a pap smear, get your friends to have a pap smear, because pap smears save lives. If you catch the cancer early enough, you can treat it really, really simply with like something minor, like a tiny little thing, and it goes away and you don't know. But if you get cancer and you don't ever go for a pap smear, it's really difficult to treat. Okay, the next thing is, what causes an incompetent cervix? So I don't use that word. Incompetent sounds really mean. We call it cervical insufficiency. Sometimes for reasons that are not very well medically explained. Women have a weakness in the muscles of their cervix. Your cervix is basically made of muscle. And sometimes those muscles can be weak, and so it means that women tend to have very early deliveries, or sometimes they have what's called recurrent second trimester loss, and that means that that they get to 16 weeks, 17 weeks, 18 weeks, and then suddenly their waters break. It's not very common that it happens, and it's, again, we talked a little bit earlier about skin integrity. Different people have different genetic constructions of things like their muscles, like their collagen, like their proteins and things like this. And so what happens is some people just have a weakness in the cervix, and sometimes there's a family history as well, that you find out that actually someone that has this problem, their sister had the same problem. So it can sometimes be related to the genetics of the person. There's also lots and lots and lots of research right now going into what's called the vaginal microbiome and looking at how bacteria interplay with your cervical strength. So at the moment, the final answer as to what causes cervical insufficiency, not incompetence, insufficiency, is still out. But generally, it can be related to genetics, that people have problems with keeping pregnancies for long. But if you do have that problem, if you know that you've had a baby before at 16 weeks and you wonder why you lost that pregnancy, come and see a doctor before you get pregnant or very early in your pregnancy, because there are things we can do to help. Okay? Can a keloid be treated on the CS scar? Yes and no. Basically, yes. If you have a keloid scar, you can, anywhere on your body, a keloid scar is basically a very thick scar. Some people, particularly people of African origin, when they scar, the tissue repair process results in a thicker scar. So sometimes a woman will have a cesarean section and will develop a keloid scar where the cesarean section cut was made. They're not dangerous, but some people find them not nice to look at. It's not really the case, but some people find it a problem. Basically, what we can do to treat a keloid scar is you can have the scar removed with another operation, and then at that time we do injections of something called triamcinolone, which is a form of steroid we inject into the scar after we remove it. It has very variable results. Yeah, so I think we need to be very clear on this. You know, if you go to a doctor, any doctor, who says, I can remove your keloid scar and then I can make sure it never comes back again, that doctor is very optimistic, but is not definitely right. So sometimes you can do the treatments. We do our best to make sure you don't have a keloid scar, but they do still come back. The treatments for keloid scarring are not super effective. So I would say that yes, we can try and help you with a keloid scar if it's what you want. However, to be honest with you, the success rates of using those medications and doing things is not fantastic, but it might help a bit. So the next thing is, how do you do we deal with placenta accreta? Okay, the short answer to that question is no. Okay, I'm sorry if you have a placenta accreta right now and you'd like to come to Jacaranda, but I need to explain what that is and to give you some advice. So if you're the person who asked this question and you know you have a placenta accreta, I will explain what that is and also explain what you should do about it. Placenta accreta is rare. Okay, it's a very rare thing that happens. When you are pregnant, you have your womb, and inside you have the placenta and the baby. They're forming, and when you connect together, usually the placenta and the womb, they have a connection. But with placenta accreta, what happens is that the placenta invades through the womb. It goes through the endometrium, which is the lining of the womb, goes through the lining of the womb and continues into the muscle of the womb and even further along. Now, in my country, I'm from the UK, I work in London, usually. When a woman comes to our hospital and has a placenta accreta, usually we send them, even if we work in a big hospital, we send them to an accreta centre. So there's like, I think the one I used to send people to is St George's Hospital in London. So if I was working in Westminster Hospital or wherever I was, and then I would meet a woman with a placenta accreta, I would say, okay, look, you can deliver your baby with us, but it's safer to deliver in a accreta centre, because there is a place where they have doctors who do lots and lots of accreta surgery. The reason for this is that when you do a cesarean, you have to deliver the baby, and then what happens immediately after delivering the baby is the placenta separates. But if you have an accreta and the placenta is completely tied into the womb, the placenta won't separate. And what will the placenta do when it won't separate is it will bleed. And then you can't separate it from the womb without removing the womb. So this is what accreta is. It can be very, very serious. And so the best thing is when you have a woman that you know has an accreta is to deliver her in a hospital where there is A, surgeons who do lots and lots of accreta work, and B, a good blood bank. Our hospital has a good blood bank, but it has a limited amount of blood. You know, our hospitals with Jacaranda are a normal size hospital, but they're smaller. So with our blood bank, we have a few units of blood, specific units for managing these things. However, if you have an accreta, you might need access to a lot more blood than any small hospital can offer you. So I would definitely suggest that if you're the woman who asked that question and you're listening and you have an accreta, you need to go to a very big level 5 hospital and tell them you have an accreta. So if you are very financially well off and you can go to some of the private hospitals, go to a big private hospital and say I have an accreta, and then they can see if they can look after you. But the smaller hospitals like Jacaranda, the level 3, level 4 hospitals that we run, I don't think it's safe to deliver an accreta patient here, because the surgery tends to require a big team of doctors. You have like 2 anaesthetists and 2 consultants and then a registrar and then a perfusionist and all of these kind of people you need, which you're not going to get that level of care in a hospital that is a level 3 or level 4 hospital, not a level 5. So if you're listening and you ask that question, things are usually going to be okay, yeah, but you definitely need to deliver in a place that has that expertise, and I hope everything is okay with you. The next thing is, what's the importance of folic acid to the mother and the baby? This is a simple one. Folic acid is vitamin B9. That's the other, it is a vitamin B, like B12, B9. So B9 is called folic acid. Folic acid is very important in the formation of your baby's brain and spine. So when you get pregnant and the first day you find out you have a positive pregnancy test, the next thing you should do is buy a bunch of spinach and eat it, or go better still, go to Dukaladao and buy some pregnancy multivitamins like Pregnacare, Preganine, Pregadase, Advit, many of them. And you take your pregnancy tablets. They contain a lot of folic acid, which helps you have it. Many times women come to me and they've just found out they're pregnant at 12 weeks and they say, oh, should I be taking folic acid? I'm like, sure, it's fine, but it would be much better if you were taking it when you first found out you were pregnant. Okay, so if you find out, if you miss your period and you have a positive pregnancy test, then you definitely want to be like, okay, right, I'm pregnant, I should be taking folic acid straight away. And even better, if you're planning a pregnancy and you're really trying to get pregnant, then maybe you should be taking folic acid before you get pregnant, because you want your folic acid levels in your blood to be really good, so that when your baby is forming, there's low chance of issues with the spine and the brain. What's next? Hello. This person said, hello. I'm very worried, 6 weeks pregnant. The folic acid tablet's got some side effects with vomiting. So vomiting in pregnancy is really common, particularly in the first, say, 12 to 15 weeks. Some women genetically have a bit of it's like a slightly allergic reaction, really, to the pregnancy pregnancy hormones. So when you're pregnant, in the first half of your pregnancy, you make a hormone called HCG. You make a lot of it. And then in the second half of the pregnancy, you make more of estrogen and progesterone. You make all of them all the way through, but the ratios change. So in the first half of the pregnancy, you make a lot of HCG, and some people genetically, when they're exposed to HCG, makes them vomit. And it's really difficult, and for some people it's just morning sickness. Some people are lucky, they don't feel it at all, and some people have something called hyperemesis, where they vomit a lot, and it's not just morning sickness, it's like throughout the day, every time they take a tablet, every time they take a meal, they vomit. So if you're having that problem and you're vomiting a lot in pregnancy, I'm really sorry. Come and see us. We have lots of medicines that can help you feel less sick. At the same time, some people, have a particular problem with one kind of folic acid. You may be taking IFAS or Pregnacare, and it may be that tablet does make you sick, and actually you're not vomiting at any other time, and you're fine eating your food, and you're not vomiting unless you're taking the tablet. So if you're taking the tablet and it makes you vomit, we can try a different kind of tablet to see if you can tolerate that, or we can continue the tablet you have that give you anti-sickness medicine as well. So there's a solution. And folic acid is present in many foods as well, particularly green things. So the greener the vegetable, the more folic acid is in it, as long as you don't cook it to death. Spinach, those sort of things, good. Maybe don't boil them too long, and then you can eat those things as well have folic acid. Many things have folic acid in it. So just because you can't take the tablets doesn't mean you're not getting any folic acid. And the chance of brain and spine problems with your baby is very small anyway. So, but don't worry too much. But if you're vomiting a lot, come and find us and we can help you. Okay. Doctor, I was diagnosed with hypertension before pregnancy. The doctor changed my meds to methyl-dopa and aspirin, but my blood pressure is high, 140/93. How can that affect me and my unborn baby? Okay, so your doctor was right to change it because there are only a handful of blood pressure medicines that are safe in pregnancy. Methyl-dopa is one of the safest ones. But some people are on things like losartan or Amlazar or all these sort of things, and those drugs have problems in pregnancy and they can sometimes cause issues with the baby. So we want to stop the medicines that can be toxic to the baby and switch you to something else. If you've been switched to methyl-dopa and your blood pressure is still a bit high, 140/93 is high, but it's not crazy high. Don't be too worried. It's a little bit high. We can change that. It's not 160. It's not 180. Those are very high. 140 is a little bit high. So what you would need to do is come to the hospital and just say, hey, I've been checking my blood pressure at home. I'm on methyl-dopa and I'm taking this many tablets a day and I'm taking this dose. So you might be on 500 milligrams twice a day, or you might be on 250 milligrams 3 times a day. So you come and see the doctor, they check your pressure, they make sure your urine test is normal, they make sure you don't have any bad symptoms of your blood pressure, and then they're going to increase your methyl-dopa tablets to get your pressure under control. And they will achieve the control, yeah, and then your pressure will be normal, and you just continue taking the new dose of tablets, and then maybe later in your pregnancy your pressure will rise again, and we will increase the tablets again just to get you under control. Blood pressure, if it's not controlled, can cause issues in pregnancy. So it can cause the baby to be too small, it can cause bleeding on the placenta, it can sometimes cause a condition called preeclampsia where you get protein in your urine and really, really high blood pressure, which can be very serious. So we want to handle it, but I wouldn't panic too much. Yeah, 140/93 is high, but I'm not having palpitations over here. So, but please, if you've got high pressure and you know it's consistently high, come and let's increase your tablets so we can control it, and then we can get it under control, and then it's okay. Is it possible to get restitched after 5 years since birth? So some women have a situation where they've delivered a baby and they've had some sutures, but there's been a bit of a misalignment with the vagina, and so they sometimes have some problems maybe having sex or going to the toilet after the surgery. If you are unhappy with how your repair went, or if you feel that your vagina has a problem, you can come and see a gynaecologist and we can have a look and see what the problem is. Many times the issue is not as bad as you think. And obviously, we're not just trying to say, oh, well, we repaired it, so it's really good. No. Many women come to us who've delivered babies all over Nairobi, all over Kenya, all over the world. And we have a check and say, look, I know you think it's a problem, but actually it's not as bad as you think. Like, actually it's a little scar and it's going to be fine. If a woman comes and has a serious problem, like the stitching was done badly somewhere and it causes really problems for her life, yes, you can have it restitched. You come, we would have to do an operation where we take away the old scar tissue and put a new scar down. Hopefully it won't be the same problem as you've had before. But yes, the surgery is called vaginoplasty and it can be done. You can just come to the hospital and we can review and see what you need. I got my 3rd child through section. We're now 1 month today. Congratulations. So today I decided to feel the wound to see if it's healing, only to notice a small hard lump on my left side after the cesarean. Is this normal? So usually after healing there's no lump, but sometimes what happens is what's called induration, where the tissue near where the scar was made gets a bit inflamed and forms the fat underneath the skin to form something like a hard lump. It's swollen. As long as it's not hot, you don't have a fever, it's not discharging pus or anything nasty, then it's usually okay. And it will usually go away over time. But if you'd like us to see it and check that it's fine, it's okay. And sometimes if it's very large, we might need to do an ultrasound scan. Most of the time, however, it's just swollen skin near where the scar was, and over time it usually goes away by itself. You might need some antibiotics if there's any signs of infection. Can the hospital check the weight of the baby before birth? Yes, we do ultrasound scans. And it estimates. But what you need to know about estimation in ultrasound is ultrasound gets less accurate in terms of the weight estimation of the baby as you go further through the pregnancy. So the best time to estimate the weight is around about 12 weeks. 20 weeks is good as well. But when you get to the 38, 39 weeks, when you do those scans, the technology of ultrasound sometimes misinterprets it. Yeah, you can do the scan and do the best job you can of a really good scan, and it says the baby weighs 3.2 kilos, and then when the baby is born it weighs 3.8 kilos. It's not very accurate right at the end to estimate the scan. It's accurate at the beginning of the pregnancy, but less accurate at the end. So I frequently, when I see a woman's scan and they say, okay, the baby weighs 3.8 kilos at 40 weeks, I go, okay. I mean, it could be 3.8, it could be 3.5, could be 4.0. There's a margin of error, and if you look at your ultrasound reports as well, they will report the weight and say 3.05 grams, and then in brackets afterwards say plus or minus 425 grams, because they're just giving a rough estimate, so they can't accurately estimate the weight 100%, but it gives us an idea. Right then, we have some more questions that have come in from the live chat. So, is 37 weeks considered full term? Can labour start on its own by 37 weeks? Yes. So your due date is your due date. However, that is 40 weeks as your due date. That a woman can safely and normally deliver a baby anytime from 37, 38, 39, 40, 41 weeks. So in that period, so your due date is a calculated, accurate due date, but your delivery time around it, the sort of 2 to 3 weeks on either side, is what we call term. And that means that the baby could come at any time. So if you're 37 weeks, you can definitely go into labour. My wife is 5 months pregnant and she has a lot of discharge and it's really burning down there. Most of the time, again, we talked about this earlier, that when you're pregnant, your immune system gets weaker. So when your immune system gets weaker, sometimes you can develop what's called thrush. Inside the vagina, there are bacteria, good bacteria, bad bacteria. One of the normal bacteria or yeast inside the vagina is something called Candida. Candida exists on your skin and also in the vagina, and most of the time doesn't cause a problem. But when you're pregnant and your immune system is weaker, you can get an overgrowth of this Candida, and we call it a yeast infection. So if you're having itchy and discharge and burning during your pregnancy, then you're definitely welcome to come and we can give you some medicine to clear up that yeast infection. Is mucus discharge normal at 17 weeks? A little bit. Discharge does change in pregnancy, so if you're having a bit of vaginal discharge at 17 weeks and it's not smelling bad and it's not burning and it's not itching and it's just like a slight increase in the thickness and the flow, that's okay. If it's a lot, like if you're having a lot of discharge, like you're having to wear pads because so much of it's coming out, you might need to come and get checked. We can check inside and see what's happening. But most of the time it's okay. But if you're really getting wet with that much discharge, then it's a good idea to come and have a speculum to check what's happening. How much HCG should be tested on the 14th day after embryo transfer? Interesting question. Okay, on the 14th day after embryo transfer, you are effectively 3 weeks pregnant. So there is a chart that gives a rough estimate of what your HCG level should be at certain gestations, but it is rough. So if you're 14 days after your embryo transfer, we're talking about IVF here. If you're 14 days after your embryo transfer, you should be testing positive for HCG if the embryo transfer is effective. So yes, you would do a serum HCG if you wanted to check. A pregnancy test on a dipstick, like a normal pregnancy test, might still be negative. But when taking the blood test, you should be seeing something. Now, a pregnancy test is normally positive when the HCG level is more than 25. This is a rough guess because usually I refer to a chart. I'm trying to remember the numbers in my head. But basically the HCG 3 weeks of conception should probably be somewhere around 100, 200, 300 is my rough guess. But usually I refer to the chart because I don't remember all the weeks and the numbers. But your HCG should be positive if it was successful. If it's less than 25 on the serum HCG, it may not be positive. But I hope it's positive for you. Is it bad to use Actel for heartburn during pregnancy? So most heartburn medications are safe in pregnancy. You're going to want to check the thing. Now, many times drug companies write on their pregnancy, on their drugs, oh, it's not safe in pregnancy, but they just don't want pregnant women to take their drugs, because if there's anything complication-wise, then the pharmaceutical companies are in trouble. So many drugs say, most drugs, even paracetamol, simple things, say in there, please speak to your doctor before taking this medicine, so that the doctor takes responsibility. I must admit, Actel, in Kenya there are many, many different pharmaceutical companies, and so you can go into any duka la dawa and you find 17 different kinds of heartburn medicine and then 16 kinds of antibiotics, and they're all got different names. So Actel is a drug whose name I do not know. It is probably just alginate, magnesium alginate, which is basically like Gaviscon or Pepto-Bismol, and these things are just heartburn medicines and they're safe in pregnancy. So yes, you can take it, but I'm just specifying that Actel is not one of the brands I know the name of, so I can't give you the 100% yes. So if you need to check, you should check with a doctor. But I think Actel sounds like a heartburn medication, and most heartburn medications are safe in pregnancy. Is 18 weeks pregnant, feeling pain in my stomach and lower abdomen? So if you're feeling pain at 18 weeks, it's unlikely to be early labour, because you're very, very early, but you can come and get checked out. If the pain is like period pain that's getting more and more intense, and it's cramping and then it goes away and then it's back and then it goes away, you definitely need to be seen urgently. If it hurts when you pee as well, when you're passing urine it hurts, then it can be that you have a bladder infection, because your bladder is right next to your womb. So sometimes when you're peeing or you're having pain lower down, it can be because of a urine infection. So I'd recommend, if you're having pain enough to put it on TikTok for the world to see, then you might want to go to a doctor to get a urine test and check what's going on. My 8-week-old baby hasn't pooped in 5 days. Is it normal? No, you should go and see a pediatrician. It's not normal for babies not to poop, particularly when the baby's 8 weeks old. Sometimes there's a condition called Hirschsprung's, which can happen where the babies get really, really badly constipated after birth. So I would definitely recommend that if your baby hasn't passed stool in a few days and the baby's 8 weeks pregnant, you 100% need to take that baby to see a baby doctor and ask about Hirschsprung's. What causes lower abdominal pain, especially after walking? I am 23 weeks. So remember we were talking earlier about the chest, how it widens in pregnancy. The hips also widen. So when the hips are widening, sometimes the ligaments in your hips get a bit unstable and a bit painful. So when women are walking around a lot, sometimes it's that instability in their hips that results from the hips widening that causes a bit of pain. Paracetamol is again your friend. It's very safe in pregnancy. Obviously, like I said, if you're having lower abdominal pain, which is causing cramping and bleeding and these sorts of things, you might need to see a doctor. But if it's just around your hips and your lower abdomen, and it's only when you're walking, it's probably just the hip ligaments doing these things. Are we going to be done on this? Yeah? Okay. Hello, Doc. I'm 1 month post-delivery and my body is painful, even my fingers. What should I do? So if you're having pain in your fingers after delivery, then it might be a good idea to come and see a doctor so they can examine your hands. Sometimes women develop certain joint problems after pregnancy, such as rheumatoid. So I would recommend that if you're having pain all over your body, and particularly your fingers are hurting after a month after delivery, it might not be a bad idea to come and get a doctor. I'll be happy to see you, to look at the hands and make sure that you don't have any signs of individual joint swelling that might be indicative of something like rheumatoid. But your body is going back to normal as well. So there may be changes in your body that cause this kind of pain, but I think if you're particularly having problems with your hands after delivery, you might want to see a doctor who knows something about rheumatology. Is it advisable to do a Bartholin surgery? Sure. If you have a Bartholin cyst, you should have a Bartholin surgery. A Bartholin cyst is in the vagina, on the vulva. There are some ducts that release some liquid as part of normal vaginal health. Sometimes those ducts get blocked and then you end up with a cyst which is blocking one side. It hurts a lot, apparently, and sometimes they can get very large and very infected and very tender. So if you have a large cyst, you can come and we assess and consider doing an operation to remove it. Sometimes if it's very small, you might just need some antibiotics. But if it's a big enough cyst to require surgery, do the surgery because you'll be a lot more comfortable. Is there a possibility to have a normal delivery with a low-lying placenta? Alas, no. If your placenta is low, it's blocking the baby's exit, so you cannot deliver the baby normally. The thing is the placenta sometimes moves a lot in pregnancy. So if someone's told you you have a low placenta when you're 22 weeks, don't worry too much. When we scan you again later when you're 32 weeks, 36 weeks, probably the placenta will move out of the way. That's because the lower part of the womb grows faster than the top part, so the lower part pulls up, and so the placenta moves out of the way. It's but if you're towards the end of your pregnancy, if you're 36 weeks now, and someone told you your placenta is low, then I'm afraid you must have a cesarean because the baby will not deliver past the placenta. I accidentally got pregnant 1 year following cesarean. Any risk factors? So generally, the risk factors are we advise women to constantly stay 2 years apart in their pregnancies because your body generally needs about 2 years to completely heal and recover completely from a pregnancy. Imagine your body has stores, so it has iron stores and zinc stores and selenium stores and copper stores. Your body has all of these stores, and when you're pregnant you deplete most of your stores. There's not much left at the end of the pregnancy. You've spent a lot of that time growing a new person, and they've taken a lot of things from you. If you get pregnant immediately afterwards or within 1 year afterwards, your body hasn't really built those stores back up. So you generally want to aim to do a 2 year gap between your pregnancy. However, if you're only 1 year since your cesarean section, things will probably be okay. You don't have to worry. There are some studies that say that you can have complications with the scar if you get pregnant too quickly, but you waited a whole year before you had the next positive pregnancy test, so probably the chance of a serious problem is no. And the other thing is your mode of delivery is affected by the cesarean as well. So if you've had a cesarean 1 year ago and you get pregnant and you think, oh, maybe I'd like to deliver this baby normally, have a VBAC, you can't because you've had this scar and the scar hasn't been given time enough to heal. There are some other studies as well that suggest that the placenta can sometimes be low if you get pregnant quickly afterwards, but then there are other studies that contradict that as well. So it's all a bit ruled out. But basically, if you are pregnant 1 year after having a cesarean, then when you come and see me, I will go, you should have waited. But the point is, it'll be okay generally. So the next thing is I have, hello, can you talk about, oh we did. Do you allow other birth positions other than lying on your back? Yes, you can deliver on all fours, you can deliver standing. Generally though, we tend to advise people to deliver in the lithotomy position. The lithotomy position is slightly more easy to control. Most of our staff are very comfortable with it, so you can deliver on all fours. If you have a midwife, like a midwife who's like, yes, I can help you with that. Sometimes pushing in different birth positions is a good idea. So when you get to full dilation and you're ready to push your baby, sometimes it's good to push while you're standing or while you're in all fours. But it's just that point of delivery for that really good head control. Most of our babies are delivered in lithotomy. Okay. And then can you talk about sweep? Yeah. So when you get to your due date, if you've not had your baby yet, we will offer you a sweep. A sweep is where we do a exam of your cervix to check how open it is, and then we basically roll around the cervix and stretch it in order to release the membranes around the baby's head that are connected to the inside of the cervix, and it naturally stimulates your body to go into labor. So your cervix, when it's starting to open, makes a medicine called prostaglandin. And prostaglandin naturally occurs in the cervix and it stimulates labor. So by doing a stretch and sweep and stretching the cervix, you can naturally cause the cervix to make this prostaglandin. Interestingly, if you're a patient who's booked for an induction of labor and we're trying to get you to have your baby for some medical reason slightly early, what medicine are we giving you? We're giving you prostaglandin. So we're giving you what your body naturally makes in order to help you have your baby. I have gestational diabetes. My doc, I had stillbirth last time Now he wants to do an induction at 38 weeks. I agree with this doctor. If you have had a stillbirth before and you have gestational diabetes, you have another risk factor for having a stillbirth again. So I would heavily recommend that you deliver your baby at 38 weeks earlier if there's a problem with the scan, because stillbirth doesn't usually happen twice, but you've got diabetes as well, and so that's a risk factor for stillbirth. So if you've got to 38 weeks, the baby is ready to come, let's have this baby. So I would definitely agree. I think that doctor's made a very good decision. I have a large ovarian cyst growing with pregnancy, and I worry, is CS the best option? So the ovarian cyst does not impact on how you deliver your baby, and I would not recommend this. Obviously, there are many different kinds of ovarian cyst, so I don't want to give you lots and lots of advice on what to do because I don't know what kind of ovarian cyst it is. If it's a simple cyst, if it's less than 7 centimeters, I wouldn't worry about it too much. If it's a complex cyst or it's really, really large, like 25 centimeters, then it might be sensible to do a cesarean to remove it. But most of the time, cysts are made worse by pregnancy. The hormones can cause problems. So what I would suggest to you is deliver your baby normally and then rescan a few months later. But I'm not sure what cyst it is, so I don't want to give you that advice without knowing more. But your options are to have a cesarean to remove it if it's really, really large. But for me, I would say try and deliver your baby normally, and then 3 months after the baby's born, assuming that it's a safe kind of cyst, because there are some bad kind of cysts, repeat the scan, because you may find that without the pregnancy hormones running through your body, the cyst might go away. You might not need a surgery. Can one have a VBAC 2 years after cesarean? Reason for the cesarean was placenta calcification grade 3. Typically, yes, if you had a cesarean before. You basically need to come and see a consultant. If you're planning on delivering at Jacaranda, come and find a consultant. There's me or there's Dr. Osoro, and we will take you through the risks and benefits of VBAC and have a discussion about your obstetric history and talk about it. Yes, you need to come and make an assessment, basically. So I can't say to you on a TikTok, yes, you can have a VBAC. We need to go through what happened during your surgery, how your baby was, all these sort of things, how many children you've had, etc., etc., and then we can have a discussion. So, but VBAC is possible. You just need to come and speak to us and we can have a discussion about it. And if you meet the criteria and things are safe, then we can think about it. If you are on sustain, is it normal to have discharge at 23 weeks? So if you're on sustain, it might be because you've had bleeding in pregnancy, it might be because you have a risk of preterm labour. So if you're having very heavy discharge, and it's very different from how it was yesterday, and you're on sustain, it would not be a bad idea to come and have a speculum. We need to check what's going on, because sometimes sustain is helping you stay pregnant, but also maybe the cervix could be opening, and we need to check that, because sometimes you can have what's called a rescue stitch. So if you're having changes that are sudden in your vaginal discharge and you're on sustain because you have a risk of preterm birth, then come and let us have a look and check. How long after can I get pregnant after removing the depot? How long can I get pregnant? Okay, so if you have a depot and you don't renew the depot lasts for about 3 months. So if you don't renew it, then your period should sync up within 3 months after you haven't had the injection. So if you've had the depot and then you refuse to have the next one because you want to get pregnant, then you're looking at up to 3 months on average for your periods to return to normal. Sometimes it happens after the first month. Sometimes it happens after 5 months that your periods, you have some weird periods for a few months after the last depot, but then by 6 months you are like really back to normal. So I would say if you stopped using the depot, then you can get pregnant anytime, but your periods will probably not go completely back to normal for 1 or 2, 3 months. So thank you very much. I think that's all the questions for today, and hopefully see you again next month. Thank you.